Good afternoon, everyone. I'm Dario Harris. I am the facilitator for the day. Please welcome to our Assessing Policy to Promote Racial Equity webinar. Today's webinar is about, excuse me, policy is often touted as the great equalizer, creating opportunities for all regardless of their race. Yet evaluating a policy's capacity to address racial equity is not easy. Today, we're going to hear two examples of how to assess and evaluate policy to promote racial equity. First, we're going to have Dr. Keshia Porter Pollack, Chair of the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. And then we'll have representatives from Jefferson County Food Policy Council. So I just want to give a brief introduction to Dr. Keshia Pollack. She's a full professor. She's the chair of the Department of Health Policy and Management here at Johns Hopkins School of Public Health. She's affiliated with the Centers for American Indian Health, the Johns Hopkins Center for Health Disparities Solutions, the Johns Hopkins Center for Injury Research and Policy, the Johns Hopkins Education and Research Center for Occupational Safety and Health, and the Institute for Health and Social Policy. After her will be the Jefferson Food Policy Council, and they are a diverse stakeholder collaborative in Jefferson County, Colorado, composed of local governments, nonprofit organizations, food and farm businesses, residents, and policymakers, totaling over 95 committed organizations and more than 65 individual residents. Speaking on behalf of Jefferson County will be Hallie Nelson, who is a director of Jefferson County Food Policy Council. She joined the Food Policy Council team in May of this year. Also, we will have Willow Cozzens, who is the Food Equity and Recovery Specialist at Jefferson County. And then we'll have Moriah Bell, who is a community member and has been a member of the Jefferson County Food Policy Council since 2019. I want to pass it over now. And I forgot to say that we are Center for Livable Future at Johns Hopkins University, and we are also the Food Policy Networks. The Food Policy Networks, our goal is to building communities, applying research and cultivating action. We have a national listserv of over 1,800 members. We have a Food Policy Council directory of 300 plus councils. We have a food policy resource database with 1,300 and more resources. We do webinars, discussions, and meetings. We also do trainings and technical assistance. We have working groups on communication issues. We do pre-conference workshops and conference sessions, and we also do curbside consulting. And so we want to invite you to visit our webpage if you would like to learn more about us and sign up for, or go through our resources and sign up for any of the things that we offer. At this time, I'd like to pass it over to Dr. Keshia Pollack, and she will share with us some of the work that she's done recently.
Great, thank you so much, Daryl. Thank you all for being here today. Thank you for having me. As Daryl said, my name is Keshia Porter Pollack, and I am the chair of the Department of Health Policy and Management at Bloomberg School of Public Health. I'm gonna share my screen and just talk for I think about 20 minutes, and then I'll turn it to my panelists who I'm excited to hear from as well. So let me go ahead and talk to you about one type of assessment that can be done to look at or promote racial equity. So I'm going to, hopefully everybody can see my screen okay. And I'm gonna get this out of here. Okay, great. Sorry, give me 1 second. Let me hide the floating controls. All right, perfect. All right. So let's go ahead. In our time today, I'm going to actually focus on one particular tool called Racial Equity Impact Assessment or Racial Equity Impact Analysis. And these are called RIAs. So when you hear me say RIA, That is their acronym. And I'll talk to you a little bit about how to do a RIA. I do this in my work. I'll tell you a little bit about how we came to do this over a few months ago. And then we'll have some time, I guess, at the end of both presentations for questions. But I encourage you also to put any questions in the chat. I'll drop my email in there too if we don't get to all the questions today. So as Daryl mentioned, policy is incredibly important in terms of helping to create the type of society where everybody can thrive, can achieve their full potential in terms of health and well-being. But unfortunately, we know because of structural racism and other oppressive practices that not every person has the opportunity to thrive. And a lot of our policies that are moved forward are either systematically, intentionally structured to disproportionately impact a certain population or community, or perhaps one of the unintended consequences is that there's a potential to exacerbate racial inequities. So there are a number of analyses that people do to look at racial equity impacts, and a RIA is a systematic examination of how different racial and ethnic groups could be affected by a proposed action or decision. And so the power of this tool is actually to do this analysis before the decision is made, right? So there's a proposed action, proposed policy. So we do the RIA, share the findings with the decision makers, and make a decision that we hope would actually promote racial equity and not exacerbate inequities. RIAs can be used to minimize unanticipated adverse consequences. I'm again thinking particularly about the work I do, which is around proposed policies. But RIAs can absolutely be extended and applied to practices, programs, budgetary decisions, et cetera. What we see is that RIAs can be a vital tool for addressing and dismantling and structural and institutional racism, and also for identifying new ways to address inequities. And I'll show you how that's possible when I walk through an example. I believe that RIAs are best conducted during the decision-making process, again, prior to enacting new proposals. Although I will say, I think that there's an opportunity to also impact implementation. So decisions around implementation. So not just developing new policies, but also implementing policies as well. RIAs, it's interesting. So I actually turn a lot to the Council Office of Racial Equity that's housed within DC, the DC city government. But there are also other groups that have pushed forward RIAs, like Race Forward, for example, is one of, I think, an earlier adopters of RIAs. But basically, when we think about for policies, and that's what I'm going to talk about today, particularly proposed legislation, a RIA would be applied in the following steps. So the first thing is what you would analyze a proposed bill, for example, and then really dig into the historical context and the background of the bill and the legislation, understanding and looking through to identify how the bill, if it moves forward, might affect racial equity. And the bill actually then lists, you then take the analysis and identify the possible positive and negative effects on racial, and you could sometimes look at social inequities and really highlight areas to reduce those possible negative effects. And finally, you're making a conclusion about the bill's racial equity impact. And the conclusion really highlights whether the bill addresses the symptoms of racial inequity or the deeper structures that reinforce racial inequities, or both. And when the conclusion from these bills are actually very specific to say that racial inequity could be exacerbated or widened, or we can see the gap narrow again. So the real conclusions are about how the bill will affect racial equity. So I teach a course on health impact assessments. So HIAs, you may be familiar with HIAs. Health impact assessments are used to look at the potential health implications of a proposal, similar to what we're doing for RIAs, but this is really about health and health equity. And I teach a class on that at Hopkins to graduate students. And as part of that class, a number of students self-select into doing a more practicum or applied opportunity within the course. And right around that time, Ann Palmer from CLF had sort of reached out in an email, made its way to me around doing some sort of analysis of racial equity for policy. So what I ended up doing was teaching our students how to do these. I include RIAs as I do health impact assessments and other tools into a suite of tools I use to help highlight how bills could impact health equity, racial equity, et cetera. So a number of tools really for me to advance health in all policies. So in the context of my classes are 8 weeks long, students only had a few weeks, gave them a lot of tools, put them into some groups. I'm going to just briefly walk through one example today. And this is of a bill that was proposed during the Maryland General Assembly, and this was around health and wellness standards for correctional facilities. I want to acknowledge the students who are listed on the slide who took the lead on this RIA for this bill. Within the class. And I'll walk through the bill and tell you a little bit about what it was doing and how, and highlight some of the analysis. This particular bill proposed two things. One was to establish correctional facilities health and wellness pilot program, and the other aspect was around updating minimum mandatory standards for incarcerated individuals' food services by next January. And part of doing the RIA begins with doing something that we call sort of defining the problem. And I won't list all of the points on this slide, but certainly we know that in the state of Maryland, there are 24 correctional facilities and 3 other institutions, and that a number of individuals are incarcerated and then are getting their primary food source from the carceral system. One thing I want to begin by naming for this is, as somebody like myself who's committed to dismantling structural racism and promoting racial equity, the carceral system in and of itself contributes to racial inequities. So this analysis, certainly in writing it up, you can add some comments about the carceral system, but this was really about the food services within the carceral system. And so you might say, well, Keshia, why not just say we need to get rid of the carceral system? So I wanted to say that that was not the scope of this analysis. And I acknowledge, and we acknowledge in the text that we wrote around this, that there are inherent biases and inequities related to the carceral system. So I just wanted to name that. That's not what we're talking about today, but I did want to acknowledge it. The other thing actually, let me go to the next slide. So the other part of the problem definition is really sort of to unpack all of the ways that this proposal could impact health. And so what we did was do a review of the literature and just highlight some of the health implications or what we see related to people who are incarcerated. And so we know that incarcerated individuals have a higher burden of certain chronic diseases like diabetes and COPD. And then also other instances of HIV or asthma or other types of chronic conditions, and that their impacts on life expectancy. And of course, this varies by age, by race, by gender, by sex. Part of this analysis also was to do something that we call sort of existing conditions, understanding sort of the current state. And so what the students did too is that they went ahead and found some data about, well, what do meals look like? And I want to just acknowledge that at times where we're using like prison meals, like this is language right from those sources. So I want to just honor that. But we looked at our pulled literature to say, well, what is sort of being, what's the current state of the food services system in Maryland? And ultimately you see a source of information here was from the Marshall Project. We have some images, but basically what you're seeing is that the dietary components of meals served to incarcerated populations has some adverse risks. So you can look at the photos here. So there's a lot of carbohydrate dense foods, fried foods, fatty food, high sugar. And you'll see some images here again from other institutions where you see that image in the middle from an institution in Alabama where the average meal included hot dogs and beans and a slice of bread. And then you see again, lots of snacks. And so what we're seeing is that the average meal is about 2,800 calories per day, with average price per meal being $177. And so, and a number of these places, no lunch is served. So it's breakfast and dinner. We went on to analyze the policy and look to see who would benefit or who would be harmed at the individual or the group level. And so part of the analysis was, well, if this bill moves ahead and becomes a law, who would be impacted? And so the analysis involved sort of looking at how this would impact different racial groups in terms of who was incarcerated, also looking at what would happen if the measure was not introduced. And so this is part of what we see for the analysis. And I believe the slides were shared, but if not, happy to share them to sort of break down some of these points that I'm moving over fairly quickly in the interest of time. RIA then involves doing this sort of current existing conditions to say, how do we, what is actually happening right now around the food services system in the carceral, in the institution, in the prison system in Maryland? And so what we ended up doing was pulling a bunch of data, the best available data that was available, and you'll see just some of the points here on this slide, particularly highlighting data from the Maryland Division of Corrections that shows that while $159 million was spent on health services, for example, you see that food costs were about $55 million, which really equates to, based on the population, on average less than about $1 to spend per person per meal. We also looked at sort of procurement policies, looking to see if we can learn some information about managing contracts and vendors. And certainly we know that there's some particular contextual factors and considerations such as kitchen capacity, number of individuals in the facility, et cetera. The analysis actually then moved to looking at, well, are there potential positive impacts on racial equity? And then what are the potential negative impacts on racial equity? And so if the bill was to move forward into law. So certainly there's potential to say, well, you can have a culturally competent dietitian on site who's actually serving foods, that acknowledge people's cultural backgrounds. We talked about, increasing access to plant-based meal could have some healthy benefits for individuals who are consuming meals provided by the system. Opportunity to get input from diverse perspectives, because there was some consultation that would be required as well. And then also wondering if there's some literature showing the connection between food and behavior. So wondering if there were healthier food options, would you see some changes in behavior for people who are in the system? And then on the flip side, the question we asked is, well, what are the negative effects on racial equity if this bill moves forward? And ones that we lifted up were around requiring some written requests. And so there's this provision of the bill that talks about written requests for food, and just wondering about how that would be impacted by literacy levels. Wondering too, if those requests were only in English, how would individuals who don't speak English, how would they be marginalized? And then also there was not an active ongoing engagement process about how to, about getting feedback from people who are incarcerated about the proposed dietary guidelines. Basically, the analysis showed that the bill, a few things. One is that the bill doesn't utilize a racial equity framework, and that it could and it should, particularly because this is such an important issue for racial equity. We also concluded that historically marginalized individuals, people of color, who may have disproportionate impacts of the bills because they are disproportionately represented in the prison system, particularly in Maryland. We talked about the limitations of a race-neutral approach to this policy and to other initiatives, again, ignoring the experiences of people of color, of different racial groups, and how they would be impacted disproportionately by this particular bill. Also talked about how other types of strategies related to targeting healthcare providers with dietary information and other strategies that may work outside the carceral system are not likely to have a significant impact on racial equity, unless, again, they're really designed using a racial equity framework. And finally, I mean, the main conclusion was it really comes down to how the bill is implemented, as in so many instances. It's really hard to say, well, what do we know is going to happen, right? Well, will this bill advance, hinder, or have no effect on racial equity? It's all about implementation, and recommendations from this would really target how the bill is implemented and lift that up in terms of next steps. Once that part of the analysis is done, we made a number of recommendations, including creating a cultural competency panel to review the dietitian's recommended meals, really promoting a way of centering engagement from individuals who would be impacted by the policy. Also bringing together various individuals around these issues to identify a way to get feedback from people who are incarcerated. There's some literature, including from when we presented this before, we heard about some efforts in Maryland about gardening within prison facilities. And we talked about an opportunity to do more of that. We also recommended creating an interdisciplinary task force, again, bringing people together and engaging various perspectives around healthy food options. And then also, how can we promote some policy changes to sustain using a racial equity lens in health education in food services, particularly in the carceral system. For my last minute or so, I wanted to just share a few implications of this and what it means, right? So ultimately, we did this during a class, and it was really more of a proof of concept to see, could we do this? Well, there's certainly interest to do more of these analyses, which we're excited about. But one thing I want to say is, while RIAs have the potential to highlight impacts on racial equity, it really comes down to how do we actually take these recommendations, put them into practice? How do we translate and share them with decision makers in order to actually have them inform the decisions and later implementation? To that end, the timing of when these are done is critical, because we want to present this evidence before the decision is made, particularly around a bill. Again, I said earlier, we can inform implementation, but if there is a bill around an issue, doing a RIA can provide valuable information about how that proposal could affect racial equity. I think there are questions for people who do this work about how best to obtain the voice of the community. Oftentimes these are marginalized individuals, and the question is, how do we sort of center those margins and to have their voice and to center equity in the decision making and in feedback, particularly for a group that is additionally marginalized when we're talking about people who are incarcerated. Finally, in all the RIAs I have done, one of the biggest challenges is data. And we know having data limitations can impact the analysis. Most oftentimes, data on race and ethnicity are collected in aggregate. And because of that, sometimes the data that we need to do the analyses are not available either at the scale or for the particular groups that we want to look at and to do these analysis on. So I would just say that this is a real issue. And I know there are other issues around data that are being promoted sort of nationally to help to really center and advance racial equity. And this type of work will be directly influenced by what happens with those efforts. With that, let me stop sharing my screen and say thank you for your time. And I will turn it back to Ariel or to our next presenters.
Thank you, Keshia, for that presentation. I will pass it to Jefferson County.
Thanks, Daryl. I'm going to share my screen real quick.
Yeah, thank you, Daryl. I appreciate it. I'm just going to pull up one thing. I apologize for my delay. Sorry, I'm trying to pull up an email. There we go. Or maybe and move forward. Okay, so thank you everyone for joining us today. We really appreciate it. Hallie, I don't see anything on the screen. It just says click to exit full screen. So while Hallie is, oh, there we go. There it is. It's so beautiful with all the beautiful fruit and veggies. Thank you everyone for joining us today. My name is Moriah Bell. I am actually a community member that is a part of the Jefferson County Food Policy Council. And I actually have been with the Food Policy Council, like Daryl said, since 2019 and have been serving in a few different roles. But I've been working with them since then, and I wanted to introduce both Hallie and Willow. But I would actually appreciate if both Hallie and Willow would introduce themselves, because I would love for them to provide their titles of this within this Food Policy Council as well. So Hallie, would you like to go first?
Yes. Hi, everyone. My name is Hallie Nelson, and I am the director of the Jefferson County Food Policy Council. Willow?
Hi, everyone. My name is Willow Cozzens. I am the Food Equity and Recovery Specialist with Jefferson County Public Health. And through that role, I've had various roles helping to convene and lead the Food Policy Council since early 2021. Good to be here with y'all today.
Thank you. Okay, so going forward, we're the racial equity. We have this racial equity policy toolkit that we're going to be presenting to this group. Somewhat similar to Keshia's presentation and her work that she's been doing. If you want to go to the next slide, Hallie. So just a general overview of what we'll be talking about today. We're going to provide an introduction of that toolkit, why it came about, the development of it, the sort of outline and how it's used, the pilot that we had within the Food Policy Council of the toolkit, and then some key takeaways and next steps that we have for our for this toolkit, and then for its usage within the Food Policy Council, as well as within our community.
Thanks, Moriah. So I'm going to give a little bit more background of the Jefferson County Food Policy Council. We're located in Jefferson County, Colorado, as Daryl mentioned, and we started in 2015 through Jefferson County Public Health. This year, we have become a fiscally sponsored project of the Trailhead Institute, so we've moved out of public health. And we're a community-based organization that's made of nonprofits, residents, community groups, government, food and farm businesses, and others. Our mission is to influence policy to increase equitable access to healthy, local, and affordable food, and to support a sustainable community food system. And through that mission, we hope to see a Jefferson County that is food secure with healthy food access for all residents, a vibrant and equitable farming infrastructure, a healthy ecosystem, and a thriving local economy. So in short, we're aiming to build community power through food and to facilitate food system collaboration for policy change. The Food Policy Council started our racial equity work in 2020, which Moriah is going to talk a little bit more about. And many of the organizations that are part of the Food Policy Council had been leading in racial equity work previously, but racial equity wasn't central to the Food Policy Council itself. So this racial equity work has really shaped the transition of the council outside of public health. And as a result of all of this work, we're really aiming to ground everything that we're doing in community leadership, food justice, and racial equity. We see the practice of racial equity as a constant process of introspection, learning, and improvement. And as a council, we still have a lot of work to do, which we're going to talk a little bit more about throughout the presentation.
Awesome, thanks, Hallie. So the inception of this racial equity toolkit, policy toolkit, was really, it really began with the murder of George Floyd on May 25th, 2020. So as our nation came to face a racial reckoning, the Food Policy Council began reflecting on our own role that we allowed with current food systems to dictate our policy work and continued inequities in our local system. So with that introspection and those reflections, we began starting our work on operationalizing the racial equity in our local policy to create a racially equitable food system. So this work was led by Jefferson County Food Policy Council and the Food in the Communities, and it was piloted through the Jefferson County Food Policy Council. I think, I don't know how many times we're going to say council or policy, but it's going to be a lot. So, our goal in general, like we said, was to operationalize racial equity and generally begin critically thinking and specifically looking at racial equity in our conversations, decisions, and policies. So then we had a racial equity subcommittee formed from our larger Food Policy Council. And then from there was an offshoot to the Policy Toolkit Working Group. And then you can go to the next slide, Hallie. Awesome. So the development of this process, with that offshoot of our work group, we had the policy work group. We had a small group of people begin working on what will operationalizing this look like for our council. And so we decided to begin developing and adapting from 3 different toolkits. The first was the National Farm to School Network's Racial and Social Equity Assessment Tool, which is the primary one that we used. We had the Racial Equity Tools for Food Systems Planning from the University of Wisconsin-Madison Department of Urban and Regional Planning. And then finally, we utilized the Racial Equity Toolkit and Opportunity to Operationalize Equity from the Local and Regional Government Alliance on Race and Equity. So utilizing those 3 toolkits, we kind of Frankensteined, I think is maybe a good way to say it, but we Frankensteined a way to take the great pieces that we found from each of those to really fit our community and how we need to address racial equity there. So we had monthly meetings for an entire year. And then with that, we decided to pilot it in our 2022 legislative session. So with this process and this work, we always wanted to make sure that we were constantly growing and making sure that this tool appropriately fit our community, as well as actually address racial equity. So we not only work to receive feedback from our community partners, and as you'll learn here soon from Willow, she'll explain the processes, but we wanted to make sure that we were constantly growing in our understanding of racial equity in food policy, and making sure that we were holding ourselves accountable. I'll let Willow take over from here.
Thanks, Moriah. Yeah, so as Moriah said, now I'm just going to dive a little deeper into how to use our toolkit and guide y'all through the flow of each piece. So you can see here on this slide the 4 main tools in the toolkit, and I'll go over each one in the following slides. I believe Hallie is also dropping, into the chat the link to our public-facing Google folder, so y'all can follow along in the Google folder or take a look at it later as well. You can go to the next slide. So here's the full flow chart. I know it's very tiny, and we're going to zoom in on each section in just a little bit and highlight the major sections. So go ahead to the next slide, and it'll zoom in on the first part. So you'll see here at the beginning that a proposal will be introduced in the state legislature, national legislature, local policy, what have you. And that proposal will be identified by our Food Policy Council as a bill of interest that the Food Policy Council may want to advocate for, or at least assess its racial equity implications to decide whether or not to advocate for this bill. And we'll talk a little bit more about that kind of thing when we discuss a little bit more about how we piloted the program. So then the Food Policy Council staff, as you'll see in kind of this second bubble here, will work to assess the proposal and complete what we call the supporting organization form, which is described on the next slide, please. So the supporting organization form is a Google form that allows for a central location to enter all the information about a given policy. It also asks probing questions about racial equity implications of that proposal. So in order to complete this supporting organization form, the Food Policy Council staff and volunteers will consult with organizations that are experts on the policy and support the policy as it's being legislated. Additionally, in an ideal situation, this form will be supplemented by a presentation about the proposal to the Food Policy Council itself, so that we can ask those experts questions about the proposal in real time and have some rich discussion about potential equity impacts at the beginning of the toolkit process when we're really learning about what the policy is all about. So after this is done, go ahead and go to the next slide, please. So you'll see these bubbles in red here about what we do internally after that. So subcommittee volunteers will use the information from the supporting organization form and the presentation, if it's available, to complete what we call the internal screening form. This information from the internal screening form will be completed by multiple people, volunteers within our racial equity subcommittee, and then staff will compile that information to present to the larger group. So this screening form really is central to the toolkit. It's when we're really getting into the nitty-gritty and answering questions about racial equity. If you go to the next slide, I'll talk a little bit more about what it contains. So the screening form really contains 5 sets of questions. So the first set is just identifying information, who's filling out the form for the user and the policy. The second set of questions are pre-screening questions around alignment with Food Policy Council mission and vision. So we ask a yes or no question to say, does this align with our mission and vision? And if the answer is no, you don't complete the rest of the form. If the answer is yes, you do. And then there's also a space in there to say, take some notes on why, or if you have any thoughts, say why. The third section of the screening form involves 10 screening questions with a 0 to 5 scale. So 0 being totally disagree and 5 being totally agree. And these 10 questions ask things like, how were community members involved in the development of this proposal, and how will they be involved in the implementation of the proposal if it passes? We also ask, how does the proposal increase food justice? It may or may not. How does it may or may not increase food sovereignty for communities? We also ask about implications to racial equity in food labor systems, and as well as immediate versus systemic impacts to racial equity in the food system. And so there's more questions like that, which you can see in the PDF in that Google folder that Hallie shared. The fourth section of the screening form provides opportunity for discussion, so long form questions where users can enter more lengthy thoughts around racial equity impacts using the guiding questions. And finally, there's a section for the user to provide feedback on the tool itself, talk about how easy or difficult it was to complete, if they have suggestions for improvement, things to add, things to subtract, etc. And we'll talk more about feedback in a second. You can go ahead to the next slide. So then, as we said, this is kind of the third section of that flow chart. So these results from all of the folks who complete that screening form will be synthesized and are shared with the larger group using the presentation template, which is a PowerPoint template included in the Google folder. And the Food Policy Council discusses that presentation with those results, and then can make a motion to vote on how to move forward with the policy. So then if the Food Policy Council decides to support the policy, the council will agree upon an advocacy strategy such as coalition sign-ons, letters to the editor, like conversations with legislators and other organizing tools. If the Food Policy Council decides to not support the policy after this process, the council and our racial equity subcommittee can have further conversation about how to advocate against the policy or make suggestions for improvement. And especially if the policy actually passes anyway, even without the racial equity that we're looking for, we want to figure out how the Food Policy Council can still be involved in advocacy during implementation processes so as to influence racial equity improvements as the policy is implemented. You can go to the next slide. Yes. So finally, this kind of takes us back to the beginning of that flow chart, because we want to keep reiterating that the toolkit is an iterative process. We recognize the need for consistent improvement and to hold ourselves consistently accountable to impacts of racial equity policy work and how the toolkit is influencing that and how our Food Policy Council itself is influencing policy. So therefore, we commit to continuously seeking feedback on the toolkit during its usage and throughout its implementation, and conducting at least and once annually review of its impacts. So there's more on that on the next slide, please. So that annual review will allow us to assess policy outcomes of the policies that we put through the toolkit, evaluate the full toolkit's effectiveness for actually furthering racial equity. And then, of course, during that review, we will continue to update the toolkit as needed. Next slide, please. Cool. So just going to talk a little bit about our pilot, which was our most recent step in this process, which was really exciting to be a part of. And we piloted the toolkit, as we talked about earlier, during the 2022 Colorado legislative session, which was January through May 2022. And 2 bills were identified by the Food Policy Council as proposals of interest. These were bills that were talked about in almost every conversation about policy across Colorado as related to food systems. And we knew that these were our top priorities for really understanding the racial equity implications of these 2 bills, whether they be intentional or unintentional consequences. So the subcommittee initiated the toolkit process for both the Healthy School Meals for All bill, or HSMA, and then another bill called Critical Services for Low-Income Households, but we really called it the Community Food Access Bill. I believe Hallie put those in the chat as well for folks who are interested in learning more about both of those bills. So the timing actually worked out really well for us as a Food Policy Council to bring in expert supporters of both of these bills during the legislative session. So I believe we had a presentation in like March about Healthy School Meals for All, and in April, we had somebody come in to our April meeting to talk about the Community Food Access Bill. So during these presentations, we learned all about these bills and the implications, and we had an opportunity for our council members to ask questions about racial equity implications of each bill, and we had rich discussion with opportunities to really think critically about how these bills may or may not affect racial equity in the food system. So then after that, we had further discussion with the full Food Policy Council after we went through that flow chart, like I was talking about, where our volunteers filled out the screening forms. So those screening forms were completed and then compiled for presentation to the Food Policy Council. So that stimulated further discussion based on the feedback that those who filled out the form entered in. And after these discussions, there was motions to vote. So the Food Policy Council, the way that the timing worked out, the Food Policy Council was able to vote on whether or not to support and advocate for the Healthy School Meals for All bill, and the Food Policy Council voted to support it. So essentially we signed on to the HSMA coalition, and as a Food Policy Council, individuals and as a group, we've been participating in advocacy that was presented to us through the tools through that coalition. So this bill actually did not become law during the legislative session and will instead be put to a vote in Colorado in November. So that's just another interesting way to work with the toolkit, because we're now currently developing advocacy strategies for the ballot initiative instead. And this is, we can go back to the toolkit and use what we learned to figure out how to advocate for it. For example, we're in the process of actually working with state agencies such as the Department of Agriculture to discuss how to integrate racial equity into programs that these agencies administrate. That's actually part of these bills as well. And then secondly, the Community Food Access Bill passed with bipartisan support, which was really exciting for Colorado, though we did not end up having time to totally complete the toolkit process or fully activate for this bill, as things moved very quickly, as they often do in policy. So this was another lesson in and of itself. And then lastly, we also received lots of really great feedback during the pilot, such as figuring out better ways to work with supporting organizations to answer the questions about racial equity implications through that supporting organization forum. We've also started to work more on how to create ownership within our council and make sure we have education and readiness for racial equity work. And then also we're working on better ways to develop advocacy strategies based on the toolkit results. And then next slide. So here's some of our key takeaways. We really learned a lot during this process. So this is really honestly just a short list of some of the main lessons. So number one being readiness. As I mentioned briefly on the last slide, we recognize that our Food Policy Council itself still struggles internally with racial equity values, and we really need to hold ourselves accountable to getting better at that and to always be learning and improving not only the toolkit, but our work itself, so that we can really most effectively do racial equity work for the food system, through this toolkit and otherwise. So we also saw that this was a thorough and complex project, and that we will continue to develop as our own organization develops through the transition that Hallie talked about. We will continue to assess and internalize the intentional and unintentional consequences of food systems and policy work. So that kind of encompasses all of those bullet points in the middle. And then finally, we learned that this toolkit is really just one way to operationalize racial equity work, as we've mentioned. Not only will this tool continue to help us understand racial equity implications of policies as they are legislated, but it also helps the council figure out what questions need to be asked about policies in general and how to have uncomfortable and deep conversations about racial equity work and how policy and food systems work can really help shape equity work overall. So now I'll pass it back to Hallie, who has some next steps to talk about that are on our horizon.
Thanks, Willow. Yeah, so I'm going to briefly talk about a few of the things that the council is looking at for the future of this racial equity policy toolkit. The first thing that we really want to do is start sharing this toolkit and working with other organizations to improve it. So we're going to work with some of the local organizations that are a part of the Food Policy Council to implement it at a local level, as well as some anti-hunger organizations that work at the state level and are really involved with the legislative process. So we're going to reach out to all of those organizations and share the toolkit for them to use and provide feedback on. We'll also be continuing to develop the process that's outlined in that flow chart as we are becoming our own organization as a food policy council. So there's a lot of internal processes and structures that we need to define and create as a community. And so this toolkit process will be adapted as we go through that. And Willow mentioned some stuff about readiness. As a food policy council, we really want to have every member ready to practice racial equity and really utilize this toolkit in the best way we can and incorporate racial equity in all the work that we're doing. So the first step we're taking for that is we're planning trainings for the entire Food Policy Council so that we can provide a space for introspection and learning that's needed to practice racial equity. And through those trainings, we are going to be creating shared values that are founded in racial equity for our council moving forward. We'll also continue to evaluate the effectiveness of the toolkit, not only based on the toolkit results and the feedback, but also we want to look at the outcomes that are resulting from the advocacy efforts that we're taking as a result, and also, most importantly, how the policies are actually affecting communities. So we're working on developing the evaluation for that as well. And as we've talked about throughout the presentation, this policy toolkit is a living toolkit and constantly being adaptive. So it's an iterative process. And so we're looking forward to continuing to improve it and learn.
Thanks, Hallie. I have the easy slide. So thank you so much, everyone, for being a part of this and listening to us talk about one of our favorite projects that we have with the Food Policy Council. There was one question that somewhat was answered from Enrique about the structuring of our Food Policy Council, which he had said, or they had said, I apologize. They had said, I know that food policy councils all have different forms and structures. Is the Jefferson County Food Policy Council housed within the Jefferson County government or a separate independent entity? And then his follow-up question was, or their follow-up question, again, I apologize, was, would it be if there were any challenges, or were there any challenges unique to being a nonprofit or being a county institution to getting support to develop these toolkits? So I'm going to allow Hallie to answer the structure, and then I'm going to let Willow speak to sort of those different unique challenges that we may have faced.
Yeah, so thanks for the question. As I mentioned, we were created as a part of the county public health department, and we now are a fiscally sponsored organization. So we're a nonprofit community organization. But this toolkit was primarily developed when we were a part of Jefferson County Public Health. So I'll let Willow speak to that.
Thanks, Hallie and Moriah. Yeah, our Food Policy Council has always been made up of community organizations and community individuals. And it was decided as a group that we were very interested in being very intentional about operationalizing racial equity in our work and in our policy advocacy, even as a project of the Jefferson County Public Health, which is a part of government. The values of Jefferson County Public Health and our food systems team, as well as a project that we work on in partnership with Denver County Food and Communities, have strong values around racial equity work and social justice work within the food system. So this really was grew out of those values and grew out of the values of the volunteers that we work with in our community as our constituency. And so we were able to move forward on the project because of those values being held so strongly, as well as the way that we wanted to work with policy through racial equity.
Thanks, Willow. Thanks, Hallie. There's a question from Katie, and I believe that's about the RIA. So I'm going to let Keshia take over for that.
Sorry. Yeah, thank you. I'm seeing it right here. So certainly, well, first of all, thanks for the question. So the question is there a place for RIAs or other policy analysis tools for existing policies? And I think you all probably have some thoughts on that as well, rather than proposed bills. And I would say, Katie, yes, what I'm seeing across the country is that people are looking for tools to look even at policies that are existing, looking at existing policies to then figure out recommendations to modify them, to make them more equitable. So absolutely, there is a possibility to do that. I think that there's opportunities to do that, as well as to apply RIAs for proposed bills and proposed programs and proposed initiatives. In terms of how the process would be different, I think I think one of the things that I think is helpful is that, you know, the policy is already present. You might have some evaluation data about how racial equity has been impacted, as opposed to the RIA, which is projecting how could racial equity be impacted. So that's one of the differences in terms of the data that could be available or not. But I'm excited if you're interested in thinking about doing something for existing policies.
Okay, thank you. Are there other questions either for Jefferson County or Dr. Keshia?
Looks like somebody reposted the question about how you pulled the 3 for Jefferson County.
We did not answer that, so that would be a great idea to answer. Willow, would you like to answer that?
Yeah, Moriah, you might be able to supplement, because I know this happened right before I joined the project where these were pulled from. But I know that folks who were in Jefferson County Public Health staff that helped initiate this project in the past had lots of conversations with other food policy councils and other organizations doing similar projects around racial equity toolkits. And those 3 just really jumped out at us as a group as toolkits that had similar effects or seemed to have similar questions to what we wanted to be asking. So I don't know if there was a particular process. And again, I think it was right before my time, but Moriah, you might have more insight on that as well.
Yeah, actually, that's very correct. As well as we had one of the leaders in the JCPH group was in the public health Masters of Public Health program at Johns Hopkins. So that helped that they had lots of really great resources to kind of pull from and helped provide like a larger array of toolkits that we utilized, and exactly what you said, Willow, that kind of aligned with what we were looking for. It looks like there's another question that says, what does your process of accountability look like? I can kind of give you a little bit of an answer, but I think Willow and Hallie will have something a little bit more effective. But what accountability is looking like right now is making sure that we are really on the up and up about racial equity, making sure that when we're looking at policies, we're fully invested in understanding what the critical thinking that's required to look at those policies. But then the other accountability piece is making sure that yearly we are, for those policies that we supported, making sure that we're reevaluating those policies and intentionally understanding whether or not they are achieving the racial equity that we believed that they would achieve. And then I'll let Hallie and Willow speak to it more if there's anything else.
Yeah, I'm happy to add that by kind of checking ourselves and looking at those policies, what we really want to do, and we haven't had a chance to do the annual review yet, though we've been, doing that kind of accountability work throughout this process. But when we do the annual review, we certainly want to be going straight back out to our community and having conversations with community members and community-based organizations to say, hey, how has this policy affected you? How has it not affected you? And what policies can we start to push for and create and advocate for as a food policy council to right any wrongs that have been newly created by policies that we supported, or right wrongs about that policies have created in the past. And so we really wanted to continue to be as community-based as we can, so as to understand how Jefferson County, how the Denver metro area and beyond are truly being affected by the intentional and unintentional consequences to racial equity from our policy that we support.
Yeah, thanks, Moriah and Willow. I'll also add to that. I think one aspect of accountability is that readiness that we're talking about a lot. So we have like a specific subgroup of the racial equity subcommittee that are the reviewers who are filling out this the internal screening. And so we really want to make sure that all of those reviewers understand racial equity, practice racial equity, and value it. And we're also just trying to work on that as a broader council as we're talking about. So that's a part of the accountability too, to make sure that the way we're using, the people who are using the tool really understand the practice of racial equity.
Okay, thank you. Dr. Keshia, do you have accountability part of?
Yeah, thank you, Daryl. Yes, absolutely. Particularly in the recommendations in terms of who does what with what you found, right? And so you're naming who is going to actually take the findings and actually do something with it. And oftentimes it's not myself who's doing the analysis, it are the people who are responsible for those decisions. And so, so critical to name those individuals, to engage with them through some other research I've done about how those recommendations actually, how often they actually get implemented. We found that having relationships and engaging with those individuals, those decision makers throughout the process increases the likelihood of those recommendations being implemented. But yeah, accountability is critical here.
Okay, another related question before I get to the question that's in the chat box is, how well is it received? I mean, do some people take this analysis and say, oh, this is not credible, or does everyone see it as a value add? Is it 50-50? What does that look like?
Maybe I'll start, and then maybe our colleagues might have a curious to hear how it's being received where they are. I think it depends, as many other things, right? So there are people who care a lot about evidence and science and data, and like they lean into this. There are people whose values are aligned with promoting racial equity who are really excited about this and request this type of analysis. And there are people who embrace the politics of the policy process and don't really care about this, right? And so, I mean, I think what's important for me is to know where the individuals stand who relate to, who are engaged in this issue, and to do some sort of analysis of sort of understanding people's perspectives on these issues. And so I couldn't say it's 50-50, but certainly it's mixed. But there are lots of champions for these types of analysis who I spend time with.
Okay, thank you. Jefferson County, how is yours being received?
I'll start and then let Willow and Moriah add to it. I don't think that we've had enough time after the pilot to really know. We did share the results from the pilot with the Department of Agriculture here in Colorado for the critical services for low-income households, which passed through the legislature, and they're working on the implementation now. So that has been shared with them, and we let them know that we are open talk with them about any of the feedback. So we'll see where that goes from here. Will, Moriah, do y'all have anything to add?
I would just kind of echo Keshia that, or Dr. Keshia, that we've seen it be very well received. We've also seen folks kind of say, oh, okay, and then not really continue to work on racial equity in particular within the politics of policy. But for the most part, because we work with such a great group of organizations and individuals within the Food Policy Council and within our partnerships at Jefferson County Public Health, we've been able to really have candid and frank conversations about the implications of the policy toolkit. And we've also had conversations about developing toolkits for organizations to adopt themselves, particularly for organizations locally to work on policy in similar ways. So for the most part, it's been well received and very exciting. And we're fortunate to work with organizations and individuals that value racial equity and value racial equity in policy work.
Okay, thank you for those responses. I want to take a question from the chat box. And so it reads, have any other panelists considered adopting RIAs for other types of equity considerations, such as disabilities?
Yeah, maybe I'll just add, I'll respond by saying intersectionality is critical. And so I think that we don't need to have a sort of, maybe there is a tool specifically for disabilities and equity, but looking at the intersection of people with disabilities and their race and ethnicity is absolutely a part of RIA. And so there are ways to lift up these critical intersections, even including by gender as well, which we often see included in these analyses. So certainly centering other groups and looking at those intersections is part of the practice.
Okay, thank you. Jefferson County, do you have anything for that?
I think Dr. Keshia said it perfectly. Totally agree.
Okay, so we have a Q&A that says, is the council conducting root cause analysis to better understand racial inequities of the food system? Does anybody want to touch on that?
Yeah, thanks for the question. We have done some research in the past through JCPH. So Willow, do you want to talk a little bit to that work that was done, I think around like 2021, right?
Yeah, I'll say it's another way that food systems work is so intersectional is that we understand that it is rooted in issues that seem to have nothing to do with food, but actually have so many implications to food access for our communities throughout Jefferson County. So in terms of within the policy toolkit, we do ask questions about how the policy proposal, when we're doing the screening form, may or may not address root cause issues of food policy. So, or of food access rather. So for example, one of the policies that we assessed last year was really related to immigration status and being able to access food pantries regardless of immigration status. And so we, of course, recognize this as a root cause issue to food access, and we're able to have conversations and analysis of it as we developed the toolkit during the 2021 legislative session. So root cause is definitely something that's central to the toolkit as well as more specifically food access issues. So I hope that answers at least part of the question.
I think so. So are there any other questions, or did we tackle all the questions that are in the Q&A? Well, are there any other comments that either of you want to make concerning your respective tools?
I'll add that we are really excited to share this resource with everyone and would love to hear feedback on the toolkit. We've included a form in the Google folder that was shared for people to provide feedback to us on the toolkit. You could also share if you've done similar work, and I'll also put the Food Policy Council email in the chat for anyone. We're really excited about this, and we want to learn from what others are doing and continue to improve the toolkit.
And I would just add that from my experience, doing these types of analyses are very accessible and they're important, right? And so I want to, so you don't need to have a PhD to do it. Like, I mean, there's, again, we can bring knowledge to the experience. We all can provide this lens to help look at the types of policies that are existing or the ones that are being proposed. And I just encourage you all to think about how to include this type of these types of analyses in your work. It's so important because we continue to have policies that are put forward that have these unintended consequences that are contributing to racial inequities. And there are ways to be intentional about naming those up front and identifying them through a more systematic process.
Excellent. I want to thank each of our panelists for their time and their presentation and the tools that they have shared with us today. I believe at least one person's contact information is in the chat box, Hallie's. And so if you have further questions for Hallie, you can get in contact with her. I believe this will be posted at some point. And so if you check back at our webpage sometime in the near future, then you will find this presentation if you ever want to reference it. You also have Keshia's email address is there in the chat box. So if you have questions for her, then you can reach out to her. And so thank you again to our panelists, and thank you all for tuning in. Have a nice day and go off and be equitable in all your work.
Thank you all.
Thanks, everyone. Nice to see you all.
Thank you.
And thanks, Ariel, for moderating.
No problem.
Thanks, y'all.